So I mentioned using active pause as a way to get a break in the flow of the session. And a subset of this is in a moment where you notice some activation from the client. So activation is a word that some therapists use more than others. You may or may not be using the term frequently. What I mean by this is some kind of nervous system spike. That maybe, lots of movements, fidgeting, can be that there's both excitement or maybe some anxiety. Anything that, say, if you want that this is the normal range of functioning and you have, little spikes, or they're functioning at this level instead of functioning in this area, they're more in this area. So something that tells you that they're excited, scared, moved, beyond the level that is the normal range of functioning for them, and is a little bit more difficult to deal with. So introducing active pause in such a moment is a way to ground the experience. We're not asking people to disregard that experience, to dismiss it, far from that, but just asking them at the same time as they're experiencing whatever they're doing, to take a moment, close their eyes, hold the ball, gently squeeze, breathe, move it to the other hand. And again, depending on the client, you may also add the instruction to pay attention to breathing as they hold the ball, breathe, squeeze, move to the other arm, breathe, squeeze, move to the other arm, breathe, squeeze. And what's happening there is a gentle, rhythmic effect. There is the paying attention to the breathing, but even if not especially the breathing, at least the holding. There is the possibility of calibrating, depending on the feeling, squeezing more, squeezing less. So it gives people an outlet to shift from that spiral of excitement into just paying attention to what's happening in the body. And it's a way of creating a container for experience. So in some forms of therapy, this would be called resourcing, or resourcing through the body, grounding emotions into the body. But what it is essentially a way to notice that you can have that pretty strong experience, and at the same time you don't need to be fully absorbed in it, fully taken by it, fully carried by the hurricane, but that you can also find in you a place that can focus on something else. And that something else, that body awareness, that grounding into sensation, helps you give more room to that difficult experience, so that you're able to absorb it better and you're able to contain it, essentially.